Ghana. We started off from Pittsburgh, and now we're in a van on our way up to Kumasi. We're here helping Seth Wanye, who's one of the ophthalmologists here, who has an eye clinic called the Friends Eye Center. We're providing some specialty care for both adults and kids. Hi, good to see you.
Good to see you.
There are times in your career where you realize how privileged we are as physicians and surgeons to be able to really make an impact on people's lives. And Katie and I both are very passionate about what we do because we want to help people.
These are antibiotic drops and glaucoma drops. Project Theia is our nonprofit organization that Jenny and I started. We realized that there are a lot of programs out there aimed at cataract surgery, but not a lot in terms of oculoplastic surgery, which is our specialty, and we would provide that service in places where it's not available. Look here.
The number of ophthalmologists in the country is 96 for nearly 26 million people.
Okay. Hello, how are you? I'm Jenny. Hi.
He's got droopy eyelids. He needs his eyelids to be lifted. So our plan is to go in and actually put a sling that attaches his eyelid to his forehead muscle so that he can use his forehead to lift his lids, and he'll develop normal vision that way.
This is like what we live for.
The Friends Center is reaching out to the poorest of the poor in northern Ghana. One of the challenges that I faced was the care for children with deformities around the eye. When I saw them in the villages and I knew I couldn't help them, I was just praying that somebody could come from somewhere and help them. And that's where Project Theia has been very helpful in coming. And I think that without our services, those people will be needlessly blind.
We have an awesome team, and we're very fortunate that we have people like Kathy, like Nikki, like Leela, who have come along with us with much enthusiasm, and so we're very fortunate in that. That's my goal actually for the day, is to see if I can, if it's just to say enough like silly things just out there that she just is like laughing at me.
You're pretty good at it.
I am pretty good at it, right?
Have you ever worn glasses?
Very nice. Oh, she's going to do very well. I think she deserves a piece of candy.
The mother prays that the child can see better so that she can send her to school.
He has something called pediatric glaucoma, and he's already lost one eye as a result. So we're here to try to see if these drops will work for the only eye that's left. Our hopes is that we can save the other eye.
That actually was an implant somebody else had put in and was coming out.
We've already been here for a couple of days. We already realized the challenges that Ghana and Dr. Seth Wanye is facing. Simple things like having sterile gloves and having the proper antiseptic solution for prepping for surgery are not available. Those are already a list of things that we're keeping in mind to be able to provide that.
She is happy that we'll be able to help the son to see again. And she wants to thank us and ask for God's blessing on the job that we do. That she wants the job to grow and become bigger.
Finding partners around the world who we feel like we have a similar mission and values, who we can work with on the ground, because it's very important to us that we don't just come in and leave and not have somebody there to help us develop and keep the project going, and somebody to pass our knowledge to so that we can have a lasting and permanent impact in each of the partner countries that we're working with.
If we have one in Tamale, I can also show you
Okay.
my technique. Operating with 2 procedures going on at the same time. Not necessarily sterilization, but just a clean atmosphere is not really happening.
I certainly never expected to be in the OR when all the power went out, something that I didn't expect to ever happen to me while I was operating. Luckily, Jenny brought these sort of camping headlights, so we just kept on going and everything turned out fine.
You ask if she's having any pain?
Yeah. Okay, there's no pain.
Okay. She's one of the patients that we're going to try to coordinate with our ocularist to get a scleroshell.
They are very happy. They have already seen some changes.
She looks really straight. Nice. That's awesome.
See, straight now. Good. You want to go out and show your mom? Okay.
She wants to be a nurse. She can be a nurse.
Yes.
We're hoping that our ocularist in Pittsburgh can make some prosthesis for her, and we're going to try to arrange for that. But she's healing nicely.
I was happy that she showed up again.
Yeah.
And I said, oh, you guys are coming, so they should try and be here. All that we have done for the past 3 days is possible because of Project Theia. And I think it has been wonderful. Especially, I was touched by the kids being able to see properly, being able to go back to school, see on the blackboard, and then perform well in their class. For me, that was a very, very important.
Where are we heading?
Tamale.
To Tamale.
To the north we go.
We've learned a lot about Ghana, both medically and culturally. There are many goats here, but there are even more potholes in the road. And driving 10 hours can be very bumpy. They're very patient people, very thankful people, and very welcoming people to us. We've really enjoyed being with them, and we'll definitely come back.
There's always a smile on the Ghanaian people, regardless of their situation. Every person that we've encountered are happy to see us. They're just very bright, optimistic, and positive people. You can see me very clearly? Good.
You can see you are short.
I'm short, okay. I'll take that.
Close your eyes.
We can bring the eyelid in a better place, so when he closes, close your eye. It's nicer.
This gentleman had a motor vehicle accident and had some extensive scarring, so he can't close his eyes all the way. And if you can't close your eyes dry out and it can lead to blindness. So I'm gonna put his lid back in the proper position so he can open and close well and protect his eye.
Because we are in a much rural area, we're seeing much more serious things today. They're coming looking for a solution, but you realize that unfortunately there are lots of things that you couldn't just do right here. That's what we're encountering today. Ayi? Yeah, I'm Jenny. Seth wanted us to see her because he wants us to reconstruct this upper eyelid so that at some point she can wear prosthesis.
She's the one taking care of her siblings. Their mom is dead. She can't look directly at the siblings, so she'll be very happy if something can be done for her to be able to look directly at the children.
So if we do this, see how you see better, right? And if I do this, you see better.
Yeah.
Yeah, okay. So we can do it.
Yeah, you do bilateral?
Bilateral.
Yeah, you were.
She went from seeing counting fingers to pretty much driving vision.
What did she see? What's the translation of that?
So he came in yesterday with bilateral cataract. He said he hopes and then prays to God that because of us, his eyes will now become like a newly born baby. For me, if every day one blind person is able to see, I think it's a great impact on the lives of that person and his family. And I think that if we will all put our hands together and do the little bit that we can do, Ghana will be a better place. On behalf of my team, on behalf of the people of Northern Region, on behalf of the people of Ashanti Region, Kumasi, and on behalf of the people of Ghana, I want to say thank you. And as Jenny said, this is the beginning.
I just want to take this opportunity too to just be really thankful for the people who have helped us. We are so grateful for all that you've done for us, and the encouragement, the contributions. It definitely pushes forward.
And look down at the ground. Key to Project Theia's success is the people who are contributing to it. All the surgeons and the nurses here, but it's also people at home who have really helped us in donating, in providing monetary donations in order for us to get to where we are here in Ghana. We really rely on everybody who's helped us along the way. There are many ways to contribute, and we're really thankful to all the people back home who have helped make this trip possible.